Um, if you are interested in watching that, we'll send out the link. Yesterday's meeting will be posted soon. And so we'll send out the link in our school follow-up email. All right, let's get into some data. So this continues to be really good news. As you can see, this data is from March 8th, which is a couple of days ago. Previously, the CDC COVID data tracker was updated every day, and so we got really updated information. But I believe that when they started the new community levels page, they changed the COVID data tracker from daily updates to weekly updates because the data that's still posted there is either from March 8th or March 7th. So I'm not exactly sure what their plan is with the COVID data tracker. I don't know when they'll update it again, but this is the most up-to-date information that we have. So we did go down another step from substantial transmission to moderate transmission, so that's great news. Our rates do continue to decrease even further. We only had 459 COVID cases in the county in the last 7-day period. Was about half of what I reported a week ago. There were over 900. So we continue to cut our rates at about half, which is crazy. Our cases per 100,000 are now under 50 for the first time in months. This was big news here at the health department. It's very exciting. We're down to about 43 cases per 100,000 people in Pima County. Our test positivity is 5.44%, and 71.6% of our eligible population have been fully vaccinated. Here's our schools data. As you can see, even here, rates continue to fall. So if we just look at number of cases, which is in red, last week, or this data is a little bit older, but 237 cases. And the first week of March, we were down to 139 cases. So it's great news. Here is the CDC community level. So this is just a reminder for you of kind of what the criteria is for the 3 different levels. And then this is a snippet from Pima County's hospital data. So we're less than 200 cases per 100,000. We're about 43, 44. So then these are the other 2 data points. New admissions of confirmed COVID positive were at 11.6. So that would still put us in medium. And then percent of staffed inpatient beds used by COVID patients were at 5.1, which would put us in low. So the tricky thing is we knew we were going to go to medium because they're still updating this hospital data every day. Now that they are not updating that every day, I'm not sure if this 11.6 will drop enough to put us into low, but it should be updated someday in the next day or 2. So we may stay in medium for another week or so, or we may go to low. I'm not sure, to be honest. And then these are just the links for you. This again is the community levels page, and this is the data tracker itself, so you can look up those individual data points as far as hospital data, case rates, all of that. Okay, so this is our first piece of kind of big news. So ADHS did recently update their outbreak definition. So previously it was 2 or more epi-linked cases. Nationally, it was actually 3. So now ADHS has aligned with national guidance and defined an outbreak as 3 or more suspected or confirmed cases. This is specific to schools, but among students, children, residents, or staff, with an onset of 14 days, and transmission is believed to have occurred at the setting. So these are cases that we think transmission is happening at school. This is kind of different language, but similar to epi-linked cases. And so, yeah, so this is the new definition. which is important for other updates that are happening today. And this is a new language and a new definition because they released a new emergency measure. The previous emergency measure did expire in February because it was only good for 18 months, and 18 months had passed. So in February, they wrote this new emergency measure, has a lot of the same guidance, a little bit different language, a different outbreak definition. But if you want to read the whole emergency measure for yourself, it is linked here for you. So another huge update, we know you guys have been asking for changes for a long time, so we are finally changing our contact tracing and case investigation. So universal contact tracing is no longer required, and schools do not have to report close contacts to the health department any longer. So our team that does contact tracing case investigation will continue to do that. And so they will take on all of it. They have been doing case investigation and contact tracing on the reported schools cases, but now we will rely on the information that they get rather than information from you guys. And I'll kind of talk about some of the changes with that in a minute. But what we still need from schools is to report all suspected or confirmed cases and all suspected outbreaks of 3 or more people. What the county will do is investigate those cases and perform contact tracing. What that looks like essentially is calling the case that is positive that you've reported and talking to them about their close contacts and who their close contacts are, getting as much contact information from them as possible, and then reaching out to the close contacts and letting them know that they should quarantine. With this process, we know that we will not be able to get as much information from them as you guys get. That's why it was so imperative that schools were assisting with this process for so long, is because you have such a higher rate of being able to contact people and them answering your calls, answering your emails, and receiving information from you. We know from just historically that only about 30% of COVID positive cases answer the phone when we try to call them. So yeah, so just know that we are not able to contact them as well as you are. So if there's somebody in your school that you think, I know they're a close contact, why is the health department still letting them come to school? It's probably because we could never get their information. So just keep that in mind. But it's no longer required for you to report the close contacts to us anymore. The health department will also investigate those suspected outbreaks, and if they determine that it is indeed an outbreak, they will let you know. And we'll also provide ongoing technical assistance and support the way that we have been. So that will continue. So there are a few options when we say, you no longer have to do contact tracing case investigation. You do have options. You can continue doing contact tracing as you have been. You don't have to report those close contacts, but if you feel like it's safest for your school or your district to continue, you can continue. Another option would be kind of a happy medium where you identify a few known close contacts to whoever is the case is. And you identify them, ask them to quarantine. You will continue to update our close contact letters for you to use for this, but you don't have to report those close contacts to us. Your third option, like I said, is to do no contact tracing at all and just rely on the Pima County team to do the case investigation and contact tracing. The last piece of great news that we have for you today is that antigen test reporting is changing. So previously you've had to report every positive and negative test that you've performed, and you no longer have to report the negative antigen test results. So this is great news. So you still do have to report the positive test results to both AZDHS as well as to us. But on that kind of Google form that you use for AZDHS, where you have to enter every test result one at a time, hopefully this will cut the amount of time you spend doing that into a fraction of what it has been, because you no longer have to do all of those negative tests. We also hope that this encourages you to continue testing. This is a lot of changes as far as what has to be reported, and just the number of cases in our community in general. But we do encourage you to continue testing. This shouldn't change your testing process. This also shouldn't change your quarantine and isolation requirements. And I know a lot of schools are either discussing dropping masking mandates or already have. And in that case, just keep in mind that for quarantine and isolation, that last 5 days, if they're at school or throughout the whole time, if they're in test mask stay, they do still have to continue masking. So with these changes, quarantine, isolation, and testing don't need to change. And that is all I have. I did see a couple questions pop up in the chat that I already have the answer to. So yes, the sanitary measure will be updated. It's been updated. We're hoping to be able to share that with you today or tomorrow and get it posted on our website. So that is in the works, and we'll also be updating the test mask stay information, because you no longer have to report the close contacts, and also the definition of an outbreak is it's in there, and so we'll change that to the new definition. So those two documents will be updated and sent to you soon. How many days of masking for a fully vaccinated person who's a close contact? So 10 days of masking. If somebody is fully vaccinated and is a close contact, has not tested positive, and is asymptomatic, then it's 10 days of masking. Do we ignore the close contact sheet on the line list? I believe that you just ignore it. I don't think that they haven't updated this sheet yet, so you can just not put the close contact information in there for now. Epi may modify that as they kind of continue to make these changes within their department. So we will let you know if that changes for sure. Do you want the outbreaks to be reported via email to school support? Yes. So if you have a suspected outbreak, continue to email us at schoolsupport@pima.gov with the information of the people that are involved, and we will do some investigation based on that information. ADHS, do you have the vaccine rate broken down by age? So yeah, it's online. Kathy, let me look that up, and I will include that in the follow-up email. I know that we used to have it on our own Pima County website, and I believe it's also on ADHS, so I will look both of those up and put them in the follow-up email. Will we continue to do these weekly meetings or update the time frame and include other topics to review? Yes, so I'm glad you asked that. So we will continue to have these meetings. We're open. I don't know what you mean by update the time frame, but we are open to changes. But yes, we do intend to include other information for the health offices other than just COVID. So actually, in a couple weeks, 2 weeks, we already have something else planned for you guys that's not just COVID related. We'll probably continue to do that data updates about COVID, but our hope is that if the guidance ever stops changing, then we'll be able to cover other things and discuss other resources and other programs that we have planned, and things like that. So we do have many other plans aside from COVID. So are we setting capacity limits for large scale indoor events or requiring other recommended masks for large ones? So I know there, I don't know if masks are required for large indoor events. I know that they were working on some on updating that guidance. That guidance was last updated in January when we were in the huge Omicron surge. So they're working on updating events guidance right now. So I can look into that and see if it's ready to go. How reactive does PCHD expect to be if numbers begin climbing? So all of these things, the COVID data tracker, the community levels, you know, if cases start going back up again, then, you know, different mitigation is kind of built into those. So as our numbers go back up, if we go back from medium back up to high, then there's different mitigation that's recommended. So the problem with the county is we're not being great at being reactive, just because things are slow to filter through our system, and we rely a lot on the federal changes, and things are slow to filter through their system. So things will change if we start surging again back up like we did in January. So then more mitigation measures will come back out for sure. With these changes, is there a need to update the close contact letters? If so, when do you anticipate getting the updated letters? So I don't believe any changes need to happen currently to the close contact letters. We'll take a look at that again, but we already reviewed those within the last couple of weeks just to make sure. And I don't think that those need to be updated, or the outbreak letters. I think the only things were the sanitary measure and the test mask stay guidance. So yeah, so you should be good to go with the letters that you have and the letters that are posted on our webpage. So I think that's all the questions in the chat. If you guys have questions, you're welcome to unmute yourself and just ask them. It's up to you. Oh, I heard you for a second.
Oh, okay. Just a quick question. Test to stay requires contact tracing. Is that how you're interpreting that? So if we're not contact tracing, then we can phase out of test to stay.
Yeah, so yes, exactly. So test mask stay does involve identifying close contacts. You don't have to report those close contacts to us anymore, but that program is going to be most effective if you're at least identifying them and having them either test and mask or sent home to quarantine. So yes, so if you are not doing any contact tracing at all, then that program is going to be more difficult. You don't have to phase it out completely. It's possible that we will contact someone from your school to let them know they're a close contact and they need to quarantine. And you can always offer to them that there's an option to come to school and participate in test mask stay instead of staying home to quarantine. So it doesn't have to phase out completely, but just some changes. That makes sense.
Okay, thank you.
Yep. Kathy, it looks like you have a hand raised, so go ahead.
Yeah, I just wanted to ask, there's been some confusion I've been reading online in other school districts.
Okay.
That health offices, even when schools decide that students don't need to be masked, that health offices need to remain masked, that we fall under healthcare guidelines as opposed to school guidelines, and that students coming in to be seen will have to put on a mask. Is that something that the health department has any input on? But that's what I've been reading nationally, and the guidelines in the CDC seem to support that. Is there anything you can do to offer clarity?
So that's really interesting. That was not the impression that I was under. Health office staff, my understanding, falls under school staff. So I'm happy to ask for clarity. But yeah, we had not considered that health office staff would have different requirements.
Yeah, that's from the School Nurses Association. They're saying that the definition of healthcare facility actually includes health offices.
School clinics. Okay.
Well, school clinics and school health offices are slightly different things. I don't think we actually have any standalone clinics in our schools. Maybe some of the other districts do. But as far as the school nurse and the health office, we're considered under the same guidelines, so that may be something to look at. I can send you
Absolutely.
some of that, because the thing, it's one thing for us to keep our masks on, but we're gonna have to make sure that if kids come in to be seen and they have to be we have to provide them with a mask. That's
Right.
gonna need to be worked out and to make sure that we can accomplish that.
Yeah, absolutely. If you, if this is something that your school or district is already doing, we do have masks. I believe we still have pediatric size surgical masks as well. So if you want to request masks from us to help with this system, you can. But yeah, please send me any guidance that you've seen about this, Kathy. I'm happy to kind of run it up the chain here and get some input.
Okay, thank you.
Yep, perfect. Thank you for bringing that up. Wonderful. Any other questions for anyone? I hope that the information today was really good news on all 3 accounts. I hope that this just continues to make things easier for your schools and for you guys. But please definitely let us know if you have any questions or any ways that we can support you. And we will see you next week. Please reach out to the school support at pima.gov if you need anything, and we will send out these slides. And we actually have a letter about the contact tracing changes, and we have information from HHS about the reporting changes. So all of that will come to you shortly in our follow-up email. So thank you all. Have a wonderful weekend. If you're on spring break next week, enjoy it. If not, we'll see you back here. Have a great rest of your day.